Thank you, Acting Speaker. It's my pleasure to rise today to contribute to the Public Health and Wellbeing Further Amendment Bill 2022. And before I start my contribution in earnest, I would like to just touch on the amendment moved by the Minister for Health. On the 8th of February 2022, the Public Health and Wellbeing Amendment Bill was introduced into the Legislative Assembly. The bill addresses several areas of critical importance to public health, including creating immunity for certain officers, meaning that they will not be personally liable for actions carried out in good faith while exercising their duties under the Public Health and Wellbeing Act. And these changes bring Victoria into line with every other Australian jurisdiction which already provide protections for personal civil liability for officers performing public health functions under their respective public health legislation. So that this legislation will be consistent with every other state and territory. In Victoria, immunity provisions currently exist in the pandemic context for detention appeals officers, and this bill intends to extend that immunity outside of the pandemic scenario. So following the second reading of the bill on the 9th of February, an anomaly was identified in this bill as the term with detention review officers used instead of the correct term detention appeals officer. The term detention review officer is redundant. So to rectify this anomaly and align with the bill's original intent, we need to amend the bill, and the amendment will ensure the term detention appeals officer is used instead of detention review officer. Yes, this is a minor clarification and will ensure these officers can effectively respond outside of a pandemic context. An example of this could be some sort of biological threat or agent with high transmissibility and mortality, such as smallpox. And to eliminate or reduce any risk, we may need to exercise emergency powers to rapidly detain certain persons. So detention appeals officers play an important role in both protecting the rights of individuals and protecting public health. They provide important checks and balances when people are detained when a state of emergency is in place. It is in the public interest to protect detention appeals officers from litigation, so they can perform their critical functions to protect the rights of individuals and public health without fear of reprisal and being named in litigation. So immunity for these officers will also provide for consistency across the Act. As detention appeals officers already have immunity in the pandemic context, but currently don't have immunity in a state of emergency context, despite their role and function being similar in these situations. So most of us rarely think about the importance of public health until a crisis occurs, such as a current pandemic. That certainly captures all of our attention. But public health operates on a daily basis to keep people healthy and safe, obviously, within their communities, helping ensure we have cleaner water to drink, safe and nutritious food to eat, high quality air to breathe, and access to a broad range of services to promote human health, including vaccines. And look, as a paramedic over many years, I often saw the consequences of poor public health and wellbeing outcomes. So I know just how important it is to deliver public health and wellbeing. Here in Victoria, the Public Health and Wellbeing Act 2008 operates as the central piece of legislation designed to protect the health and wellbeing of our community. And that Act governs activities which are enforced either at a state or local government level, including the control and management of infectious diseases and microorganisms, pest control, cooling tower systems, immunisation, blood and tissue donations, and the registration of prescribed accommodation at certain businesses. This bill also strengthens many of these routine public health functions, addressing issues identified in the recent review of the Public Health and Wellbeing Regulations 2019, as well as constraints in the Act relating to testing and data collection. And the bill also delivers on outstanding government commitments stemming from the Victorian inquiry into labour hire industry and insecure work, and the Small Business Regulation Review, Visitor Economy Action Statement. So the bill amends the Act to allow for the registration of lower risk prescribed accommodation, reducing regulatory burden and costs for the owners of small visitor accommodation, such as bed and breakfast, boutique guest houses and farm stays. It also includes accommodation related to labour hire arrangements, within the prescribed accommodation framework, ensuring that labour hire workers who support critical Victorian industries are provided with accommodation that meets public standards. And we've all heard the stories about some of the accommodation that's been provided to these workers. It expands testing, data collection and further analysis powers to help improve our management and understanding of infectious diseases and the risk to public health. It expands the circumstances in which the Chief Health Officer may make an examination and testing order for the monitoring and control of infectious diseases, enabling a more targeted and potentially less restrictive public health response. And it introduces a civil statutory immunity for those officers that we spoke about before. That would protect them. It also, finally, removes the stigmatisation and references to HIV and hepatitis C from the Act, contributing to the Andrews Labor government's commitment to eliminate stigma and discrimination experienced by people living with Hep C and HIV. And I can say, in my experiences many years ago, practising as a paramedic, the stigma attached to a patient that was HIV or Hep C, I can tell you through the 80s and 90s they were treated like lepers, and it was so inappropriate, and I'm pleased to see over many decades that we're now getting to that of, the treatments are fantastic, their lifespan has increased, and the stigma, removing the stigma is so important in regard to those diseases. So I'm also very pleased that the bill makes a number of minor administrative and technical amendments, including recognising the profession of paramedicine, in line with this now being a protected profession with the Health Practitioner Regulation national law. And the functioning of a strong public health system in Victoria is fundamental to our state's ability to prevent the spread of diseases, and it delivers improved and more equitable health outcomes for our community. It reduces hospital admissions and increases our resilience to future health threats. And the amendments in this bill will help contribute to these crucial functions, ensuring the day-to-day activities of our vital public workforce are grounded in contemporary best practice reform. And again, I should acknowledge our health workers, our healthcare workers, our frontline workers through this pandemic for their fantastic efforts in keeping us safe, and also the scientists, the medical researchers, the pathologists, all of their work to get us through this terrible pandemic. Of course, yesterday we had another bill that was spoken about in this House that was protecting workers in Victoria, and thankfully it's supported by the opposition, and I thank those opposite for their support on that bill. And Acting Speaker, these amendments that we are debating today also includes further protections for Victorian workers, and this time by improving labour hire accommodation. The amendments in this bill protect the health and wellbeing of labour hire workers who support critical Victorian industries such as fruit picking and harvesting. And again, we've heard many, many stories about their efforts, but also the accommodation that some of them have, or inappropriate accommodation that some have been provided. So this bill will address that. Obviously, the inquiry found that in various ways, labour hire workers in Victoria are treated almost like a second-class worker, including through differential treatment for issues like health and safety. And through some of the consultation in the hearings, we heard many stories revealing strong link between non-compliant labour hire agencies and workers being provided inadequate and substandard accommodation. This was particularly common in some rural and regional areas, and where workers often don't get a chance to, or a choice about whether they want to stay at the accommodation provided by labour hire operators. And of course, unfortunately, in some of the rural and regional areas, accommodation can be very limited, and the options in those areas to those workers, as I say, they may not have a choice in regard to the accommodation that they end up staying in. The current regulations have no restriction on the number of bedrooms in a house, meaning that other rooms, such as the lounge room, may be used as a bedroom. Local councils have expressed concern about the current lack of consequences for operators doing the wrong thing and taking advantage of vulnerable workers. The bill responds to, actually I've got very little time left, I just want to acknowledge the efforts of the Health Minister and his staff in regard to this bill and this amendment. I thank them for obviously their hard work, and I commend this bill to the House.